Okay, this video again about the question what causes aging in humans. This is part 5. We talk about immunosenescence. The immune system is a complex network of components including white blood cells and the spleen, bone marrow, lymphatic vessels, lymph nodes, the thymus, tonsils, adenoids, mucous membranes, the skin, and the stomach and gut. The three main categories of white blood cells are granulocytes, lymphocytes, and monocytes, with lymphocytes being the most important, and they include B cells, T cells, and natural killer cells. Dysfunction of the immune system can lead to frailty, inflammation, and cancer, as well as to autoimmune diseases resulting from a hyperactive immune system attacking normal tissues as if they were foreign organisms. So here it is schematically presented what organs related to immune system. So we have here the picture. It's also appendix as part of the guts, bone marrow, tonsils, thymus, spleen, and all this surface of the guts. What is happening? Degeneration of the immune system. You can see in this picture is in more detail, so we'll talk about this. The immune system defense against infection includes physical barriers to prevent pathogens from entering the organism, followed by the innate immune system's immediate but not specific response. If pathogens evade the innate response, vertebrates have a second way of protection. This is the adaptive immune system, which is activated by the innate response. Both innate and adaptive immunity depends on immune system ability to distinguish between body proteins and foreign protein molecules. The immune system is tightly integrated into the normal process of tissue maintenance and operation. So here it is presented innate immunity and adaptive immunity. So some cells produced our body, they belong both to innate immunity and adaptive immunity. Here we see that white blood cells, they're of different kind. Aging affects the immune system, accelerating chronic inflammation of tissues and increasing morbidity. The stiffening of the extracellular matrix triggers the body aging cycle. Chronic hypoxia caused by stiff blood capillaries leads to glucose energy production, while in the undigested fat accumulates inside cells as droplets. Okay, so you understand that if we have not adequate supply of oxygen, then energy can be produced only from glucose, not from fat, and then the cells are moving the same like cancer cells. They are moving to glucose energy, glucose as energy source, and fat cannot be used. It accumulates inside the cells. This fat accumulation happens in all tissues, including the immune cells like thymus, bone marrow, spleen, and lymph nodes. The thymus involution and the growth of fatty tissue in it are most acknowledged changes in the aging immune system. Okay, we see that with age, what is happening? The fat accumulation in adipose tissue, but also in all organs. All organs, including muscles and including inner organs. Thymus involution, it is happening that size of the thymus is decreasing, sharply decreasing, and part of these tissues inside the thymus are replaced by fat, or they are full of fat. Next, we see that bone marrow also degenerates, and what we have accumulation of fat inside the bones, and inside the bone marrow is the same, and the thymus also accumulates fat. Okay. So with aging, the supply of new T cells from thymus declines, contributing to the progressing age-related failure of the immune system to respond to pathogens and to destroy damaged and malfunctioning cells. So it has name immuno-senescence. Obesity accelerates thymus involution, while calorie restriction results in regrowth of active thymus tissue. So some part of fat can be replaced by growing normal, active thymus tissue in case of calorie restriction or intense physical exercise. The amount of white fat increases with age, while brown and beige fat decrease, leading to somal dysregulation and energy imbalance in the elderly. So the difference between this different kind of adipose tissue is the number of mitochondria. Brown fat cells have a lot of mitochondria and they produce heat. But if elderly have not enough brown fat, they are freezing. And if temperature drops, they are freezing, they cannot stay cold temperature. Mitochondria produce more reactive oxygen species when burning glucose instead of fat, which reacts with, and this reactive oxygen species react with polyunsaturated fatty acids in cells and mitochondrial membranes. The oxidized polyunsaturated fatty acids accumulate inside the long-living cells as lipofuscin, which grows lysosomes in size and disrupt autophagy or self-cleaning inside the cells. Cells with bloated lysosomes undergo programmed death, and the lipofuscin accumulates already in the extracellular matrix. Macrophages try to clean up the extracellular matrix, but they cannot digest lipofuscin the same, and then they turn into unfunctional foam cells, producing pro-inflammatory signal molecules and eventually die out. So all the lipofuscin again only accumulates inside the body and especially inside the large arteries, so like aorta. So we have here a picture which is explaining what is happening because of dysfunction of mitochondria, but dysfunction of mitochondria happens as accommodation to the chronic hypoxia. Not enough oxygen, then the cells are shifting to production of energy from glucose and in part through the anaerobic process of glucose fermentation. The stomach hydrochloric acid acts as a chemical defense against ingested pathogens, but as people age, the number of cells producing acid decreases. It leads to a decrease in the overall acidity of the gastric juice, reduced protein digestion, decreased nutrient and B12 vitamin B12 absorption, and gastritis or chronic inflammation of the stomach lining can reduce the production of gastric acid and certainly the acidity of gastric juice. Medications to treat heartburn and ulcers can also decrease the production of gastric acid, leading to a lower acidity of gastric juice and more pathogens and foreign proteins getting into gastrointestinal tract. So this is very common in elderly, and especially if they take medications against this influx of gastric juice to esophagus. So it is like heartburn, and this is very common, and it has disastrous consequences. Okay, don't do it, because I was explaining already in the previous video about oxalates, what is causes this accumulation of oxalates. So you just have to detox your body from oxalates. So we see that amount of the acids in the gastric juice drops tremendously, almost 4 times to the age of 70, and we have to do something with this. Okay, protein gets into the colon if it is not digested in the stomach, if it is not split to amino acids, and then it is wherein it rots. And the microbes, some special microbes, if they accommodated to this environment, and especially they are not killed by high acidity of the stomach, they produce toxic substances like ammonia gas, for example, from proteins, and which makes the gut environment alkaline, suppresses peristalsis, and leads to constipation, destruction of the protective mucous layer in the colon, and disruption of the epithelium layer on the colon's inside, and eventually to the colon cancer. Through holes in the inflamed epithelium layer, pathogens, toxins, and foreign protein molecules are getting into the bloodstream. Then our blood transports them to all parts of our bodies. The immune system's response to foreign proteins often leads to inflammation and autoimmune diseases. However, certain measures such as probiotics, digestive enzymes, dietary interventions, intermittent fasting, and supplements to increase gastric juice acidity can help to maintain the gut protective barrier and reduce inflammation. The gastrointestinal tract contains about 80% of the immune cells that protect our bodies. This is a gate to infection and to toxins. So this 80%, up to 80% of the immune system is immune cells concentrated near the gastrointestinal tract. The lining of the digestive system, which houses immune cells, helps filter nutrients and prevent toxins and foreign proteins from entering the bloodstream. Thus, nutrition plays an important role in enhancing of health, the local immune response, and systemic immunity. It is interesting to know that both having a pet and playing in mud with kids can improve one's health. It is interesting, but again, we need diversity of the microbiome, and you can get some helpful and healthy microbiome if you play with pets or with kids. Kids are always dirty. They give you the healthy microbiome. Immature hematopoietic stem cells, also known as blood stem cells, located in the bone marrow, can differentiate into all types of blood cells, including white blood cells, red blood cells, and platelets. With aging, this blood stem cells population becomes replaced by adipose tissue and loses function. This age-related changes in the human hematopoietic stem cells, so the human blood stem cells, are associated with decreased adaptive immune system function, increased incidence of anemia, and other hematological disorders and malignancies, contributing to age-related pathologies and immunity dysfunction. You can read in more details in the referred publication. So this is how it looks like. We have red bone marrow, which is the place where all these blood stem cells are located. And in time, this red marrow is getting replaced by fat. It is just yellow fat. And fat is, this yellow fat, they call it yellow bone marrow, but it's nothing but adipose tissue. And these blood stem cells, they can differentiate in different kind of cells, like red blood cells, platelets, and white blood cells. You see how they develop. Lymph nodes play a crucial role in filtering antigens and pathogens from body fluids and acting as a communication hub for immune cells. As we age, our lymph nodes become dysfunctional. Studies indicate a decrease in their number and aging-associated degenerative features such as fibrosis and changes in the morphology and function of specialized endothelium cells lining venous capillaries. The replacement of normal tissue structure with scar-like structures, it is fibrosis, and it has named fibrosis in the lymph nodes and thymus, is a significant aspect of immune system aging and dysfunction. The same as all other organs and also the blood vessels, they are getting fibrosis, they are getting stiff, and this is the main hallmark of aging. So here we see some presentation of the aging lymph node and young lymph node. So, and we see the development of fibrosis inside the nodes and change in the functioning of the more fat is accumulated, the same as I said, because we have chronic hypoxia and fibrosis, etc. So it gets dysfunctional. Microglia, the primary innate immune cells of the brain, have two primary roles: to fight out viruses, bacteria, and other foreign invaders, and to remove also cellular debris. Neuronal function depends on the integrity of the brain's blood vessels and their ability to remove neurotoxic molecules from the intestinal fluid, including amyloid. This is important because these misfolded proteins accumulate in the brain, and so we have to do something with this. Again, I was talking about this, and the release of the losing sensitivity to insulin is one part of the amyloid accumulation. However, chronic inflammation in the elderly can lead to a loss of blood-brain barrier integrity and infiltration of peripheral immune cells into the brain. Some of these infiltrated immune cells are senescent, and they produce inflammatory signaling and contributing to chronic brain neuroinflammation and thus dementia. Here schematically is shown what is happening with blood vessels in the brain. The same like in aorta, and is the same as other blood vessels. What we have fibrosis. We have fibrosis, that's a stiffening of the blood vessels, and also accumulation of this lipofuscin, and the phagocytes try to clean up the extracellular matrix. They turn into the foam cells. They die out eventually, and these foam cells die out, and we have again more and more accumulation of this fat, oxidized fat, inside the blood vessels. And this so all supply of blood in the blood vessels is dropping. Blood pressure goes up, and we have to do something. And the only way to reduce it, it's, as I was talking in the previous video, it is to use special superactive enzymes, which are, if they are getting to the lysosomes of macrophages, they can digest, they can split this oxidized polyunsaturated fatty acids to pieces, and then these pieces can be used as nutrients, and so this also helps to reduce stiffness of the blood capillaries and other vessels. Several approaches to immune aging are being considered, including autophagy activation, which may help to slow immune system aging, calorie restriction, which has a similar effect on innate immune system activation. Clearing senescent cells with senolytics helps to reduce inflammatory signaling in inflammation, so the use of senolytic therapies, such as well-established dasatinib and the quercetin combination, I didn't use it, but yet there are other, probably more safe, like quercetin, may be an effective morbidity and frailty treatment. Resistance training is another method for reducing inflammation in older adults. However, the regeneration of the extracellular matrix is likely the first thing to try in the immune system regeneration. Again, my opinion, that stiffening of the extracellular matrix, and especially of blood vessels, is the core, the main cause of the aging. So if we will improve it, then we will slow down aging or even reverse it slowly. Okay, this video is for educational informational purposes only. It may contain copyrighted materials. Again, I give links to the images if I use them in the PDF file of presentation, and link to the presentation in the video description. And again, I express only my personal opinion, which can be different from official opinion. So, and therefore, I'm not supposed to give you medical advice. So, visitor to my channel is advised to discuss the content of this video with his or her personal physician and only act upon the advice of the professional medical experts. I never do it because I never sick. Last 30 years, I didn't have even a flu. Why? Because I'm doctor of science. I don't need advice of the medical experts. Okay, thank you for your time to watch the video. Please comment, subscribe, like, ask questions, and share information. Have a wonderful day. Ciao, ciao.